Hi, I am Rahul Parmar from 7th semester Chemical Engineering Department from Vishwakarma Government Engineering College. I take interview. My subject is a Contributor Personality Development Program. I take interview Dr.Tanya Jain. Please tell me about your education qualification and your career from the beginning.
Hi, I'm Dr. Tanya Jain. I'm a B.D.S. I passed out my Bachelor's of Dental Surgery from Bapuji Dental College, that's in Davangere, Karnataka, in the year 2007. After that, I've been into practice. Initially in Delhi, I was working with the Air Force as a civilian dentist for about 2 years before I got married. I also worked with the private clinics where I was working in a private hospital for about a year. After I got married and I settled in Ahmedabad, my husband, who's also a dentist and my batchmate, he is presently in civil hospital. So after my marriage, I was a lecturer in Karnavati School of Dentistry, Uvalsad. There I was teaching for about 2 years, after which I finally settled down to open my own clinic, and ever since, like the past 3 years, I have been practicing only in my clinic.
What do you think about your contributor or contributional personality?
Okay, as a dentist or as a doctor, my main contribution to the society is to help the needy. Okay, so when a patient comes to me with pain, whatever the situation, I have to, whatever I can do best for the patient, I have to do. So my priority is always to relieve the pain, to make the patient comfortable, to see that my patient goes out happy. That is my only aim sitting in my clinic, sorry, not in my room. So that is my only aim staying in my clinic, is so that my patient goes out happy. Whatever problem my patient has come for, that problem has been solved and my patient goes out pain free. Because dental pain or tooth pain is the worst kind of pain. So as a dentist, that is my major contribution, that I have to help without thinking of, yes, no monetary gains. I don't think in those lines. I don't think on how much money I'm going to make. I'm just going to just see my patient is there. I have to relieve the problem. The patient wants a beautiful smile. The patient wants a better looking smile. A patient wants crowns. The patient wants root canal. Whatever the treatment required, whatever I can do to the patient to help the patient, I do it.
What do you feel? What are your duties towards the society?
Towards the society, first and foremost, yes, as a doctor, as I told you, I have to help the person who comes to me. And even it's not just coming to the clinic, even walking on the road, my neighbors, my relatives, people keep calling up and they keep asking my contribution, whatever problem they have. So I have to, as a doctor, I have to help them out, whichever way. So that is the oath we have taken, that under whichever situation, we have to help the needy. Other than the contributions as a doctor, as a dentist, I also strongly believe in education. Education is one thing which I feel the society really needs at this stage, and that is the prior thing which should be given importance to. So as this is my personal, what I do is helping the needy people who cannot afford education. So I have helped the watchman children, I have helped the maids children, I have taking classes for them, basic education, school education, whatever I could do free of cost without making, but that is something which gives me happiness. And whatever time I'm left with after practicing, I do make sure that that is the least contribution I can do. Apart from that, I'm also into a lot of camps. So I go reach out to people in the schools, in the societies, where I educate them about how to take care of the teeth, because this is one thing they're going to listen to me about. So that is the least I can do. So I do a lot of free camps in the sense I go to schools, I go to societies, and wherever I meet. So I keep telling them how to maintain your teeth, how to be pain free, not have cavities. That is my contribution.
In normal situation, how do you deal with your patients?
In a normal situation, the main priority is the patient should go out happy. Simple, that's it. If the patient comes to me with a problem, that problem should be solved. Whatever I can do, if I cannot do a certain case, I make sure I call a specialist to do that. Okay, so I don't jump कि I should get money or I should get all the cut out of it. I should just see the patient's benefit. Whatever he is benefited most out of, so that is my priority. So the patient comes, whatever problem he has, that problem should be solved, and the patient, when he walks off, he should have a smile on his face. That is it.
Have you ever anytime organized other activities?
Yeah, I've done a couple of activities. Like I told you, I've done a lot of school camps. I can tell you the school. There's Doon Blossom School, Hillwood School. Then there's this SGM school. So I have gone. These are the schools where I have gone in Ahmedabad. Apart from that, even in Delhi, I have gone to a lot of camps, and in Karnataka too, where we had to go for camps. So I have gone. Then societies I have gone. So even in my clinic, I do a lot of these free camps where sometimes without patients who cannot afford or whatever. So we do kind of free camps where we don't take money. Consultations are free. So it's just a kind of giving back to the society, whatever in my way I can.
Please share any incidents where do you had chance at a contributor, good contributor?
I've done a lot of patients for free once. Even spending my own money for the material, money for all the patient cannot afford, the patient comes, see whatever I can manage on my own, and if I feel that the patient really needs it and the patient wants to get it done from me, so I definitely don't hesitate to go ahead and do a treatment for free. So even if it's my staff, my maids, or anyone, I have done a lot of free patients. There are a lot of patients I don't charge nothing at all, and I try to give them medicines for free. Whatever medicines, whatever paste I get, whatever brushes I get, whatever mouthwash I get from the MRs, that is which I get for free, I don't keep it to myself. I make sure I give it to as many people as possible, so that is the least. They will have to spend on medicines, so that is, I don't want to do that. So that is the least contribution when I do it for a needy, is doing a treatment free of cost. Where I am absolutely restricted, then I do refer them to civil hospital. There again my husband is working, so then again they are helped over there in civil hospital, so they don't have to stand in lines and whatever. If the treatment is a surgery or something which and which needs that kind of care, so I make sure I send them to civil hospital where they're given that kind of treatment, and they are again not charged and they are helped, basically.
Suppose in case one patient is very poor and cannot give a big amount of fee, at that situation what do you do?
Yeah, that's what I told you. I am not going to. If the patient is not willing to pay, but he wants to get treatment, so whatever my limitation, wherever till the place where I can, I definitely make sure to give them at least the medicines. I have a lot of antibiotic painkillers, so I at least make sure that they get free medicines when they walk out from here. They get free paste, and plus they know what their problem is, at least temporary, and if it requires an extraction, there are a lot of patients I have done free of course, so lots of them. I can name all of them, so you can ask. So that way I don't have any hesitation, so I have done a lot of social work in that sense.
Good. And the last question is, do you want to any message, convey message from your society and other academic community?
Yeah, see, for dentists, what I feel is stop thinking money always, and that is the main thing. Instead, help people how much ever we can, and with that do ethical practice, which I totally am proud of doing it. Me and my husband, we've been doing absolutely ethical practice, no cheating any patient, and when a patient walks in, money is never the priority. So I think once that part goes out of your mind and I'm not going to make money, I just have to help the person, that should be the priority of every doctor. Eventually this gets down to business and people just start thinking money, so that mentality needs to be changed. So every doctor, everyone in my field should just think of helping the person instead of just making money. So that is, and with that doing very ethical practice and not cheating anyone. If you're does not require certain treatment and still doing it for money is absolutely unethical. So that is what I've never done and I'm never going to do. So I totally believe the other doctors should also follow that. That's
Yeah. I am very much thankful for giving your important time for this important interview. Thank you.
Yeah, well.